Ever hear officials say there's community transmission and wonder what that actually means? Here's the simple version. Community transmission is when a disease is spreading person to person in a place, and you can't trace every new case back to travel or a known exposure. It's no longer one spark from outside. There are lots of little sparks inside the community. Think of glitter. If one friend walks in covered in glitter, you can point to the source. That's an imported case. But if you show up and everyone already has a little glitter on them, and no one knows who started it, that's community transmission. Why does that matter? Because it changes the playbook. When spread is traceable, you can isolate a few cases and their contacts. When it's community transmission, you shift to broader tools, more testing, better ventilation masking in crowded indoor spaces, and ramping up vaccines or treatments. It's not just a COVID thing. Flu norovirus. Measles. Lots of infections can hit community transmission. Public health teams look for signs like rising cases with no clear links, higher test positivity, more tests are coming back positive, wastewater signals going up before clinics see it, clusters in places like schools, clusters in workplaces, clusters at events. Community transmission doesn't mean panic, it means shift your odds. A few high-impact moves: stay home when you're sick, especially with fever or new symptoms. Improve air, open windows, use HEPA purifiers, meet outdoors when you can. Wear a quality mask in packed indoor spaces during surges. Keep vaccines up to date if available for that disease. Wash hands before eating. Wash hands after crowds. Don't touch your face. Here's the takeaway. When you hear community transmission, assume you could bump into the virus in normal daily life. Adjust a bit, not forever, just while levels are up. And you dramatically cut risk for you and the people around you. Quick check. Has your area reported rising wastewater or positivity lately? If yes, pick one small upgrade this week. Mask in transit, crack a window, schedule that booster. If this helped, share it with one friend and save it for the next surge. Follow for clear, no drama health explainers.